Hi, everyone. My name is Deborah Axelrod. Welcome. This is Breast Cancer Awareness Month, and I'm here to answer any questions that you may have.
If there's a history of breast cancer in your family, how early should we start testing?
And by that, you mean mammograms?
Yes.
Okay. So, for instance, if you are a 45-year-old woman, you should have been having your annual mammograms. But if you are a 35-year-old woman and say your sister had breast cancer at 30, then you can start earlier. It would be good, though, if you had breast cancer in your family, that the person who had it, who was affected by it, get tested. Okay, so if they're very young, they want to ask their doctor about some genetic testing. So we usually start at 40, but if you have a strong family history, first-degree relative, say a mother, a sister, a daughter, who had it at an early age, we would recommend that that person, if they're alive, go to their doctor and ask them if they should have a genetic test. And if they do test positive for one of these mutations, like a BRCA, then you would start testing earlier, maybe add MRI to that mammogram. That would be something that I would recommend.
I am a breast cancer survivor, and thank you. I was first diagnosed at age 42, and no one in my family ever had breast cancer, but I have a daughter and a sister. So should they have genetic testing done?
It seems like a risk factor that you had breast cancer. But you're the only one in your family. So it's very, very unlikely that you would test positive for this mutation, the BRCA. But since you do have a daughter who's wondering whether she should get tested, the person who should get tested is the index person, the person who had the disease, like you. So if there is any question, even though the likelihood is very, very low, the person who would get tested would be you.
When do you know you need a supplemental ultrasound after a mammogram?
Okay, that is an excellent question. If you are an asymptomatic woman, meaning you don't have any lumps or bumps, you have no complaints, no discharge, when would I get a sonogram? I would get it if I had very dense breasts, because a sonogram is kind of like a extension of a physical exam. So it's very good in dense-breasted women. If you have a history at a young age, you may want to supplement it also with a sonogram. But there are reasons to get sonograms, but the primary reason is if you have a dense breast, you would use that to supplement, kind of like a physical examination.
Along the same lines, I just had a mammogram done this summer, and I received a letter that everything looked good, but that I had dense breast tissue. And it was not recommended that I get an ultrasound. That was not in the letter. Should I be concerned? Should I wait till my next mammogram?
Yeah, I mean, again, do you have any family history?
Great-grandmother.
Yeah, that's a pretty remote history, though. But you're dense. You're very young. I mean, you're over 40.
I am.
Okay, so then you're appropriately being screened.
Right.
I would get a sonogram. You know, there's a new law called Are You Dense? Came out of Connecticut. Yeah, and actually the law talks about asking your doctor if you're dense. And now radiologists, mammographers have to put down and state in their report what the density of your breast is. Women with fatty breasts usually don't need anything supplemental, but someone who's young like you are young, should probably have a sonogram.
Is there a link between hormone replacement therapy with developing breast cancer?
Yes, there is. We think that people who take, for a long time, hormone replacement therapy, that they are at increased risk for developing breast cancer. You know, it's very interesting, though, that estrogen alone doesn't seem to be associated with that increased risk. But estrogen alone increases your risk of endometrial or uterine cancer. So if you are on HRT, I probably would recommend it just to get over some of the hot flashes that I know it seems like it lasts a lifetime, but it doesn't. It does go away. So I think a couple of years, but you should really talk to your doctor about it.
Okay.
That help you?
Yes, thank you.
You're welcome. I really appreciate all the questions, and I hope I gave you some good answers, and thank you very much. Thank you.